Hey everyone, this is Dr. Alan Chinosha from Town Center Family Dental in Hillsborough, New Jersey, and I'm here to talk to you about the coronavirus and what we're doing at Town Center Family Dental to prevent its transmission. Now, right now, of course, we've all heard the news that it's been declared a pandemic, which means that there is a high chance of transmission. Even though New Jersey has only seen a handful of cases, we are taking steps right now to prevent any type of transmission in our environment. And so what are those three things that we're doing? Well, number one is we're doubling down on the efforts in terms of cleanliness. We've always practiced universal precautions, which means mask and glove wear. We've always wiped down the room. In fact, a dental office is probably one of the safest places you can be because of the sensitivity that dental practices all have about virus transmission. So we've been wiping down counters and chairs for years, but what we've decided to do is to take that same level of care that we take in the clinical area, and we're now bringing it out to the non-clinical area. So when you come in for your appointments, you might notice that the person that's working at the front desk might be in the waiting area, wiping down counters and high-touch areas. So those are, for example, door handles, doorknobs, anything that people could be touching. We've also removed the magazines from the waiting area. So we're very sensitive to the possibility of any kind of transmission. And even though the likelihood is very, very remote, we're not taking any chances with your health. The second thing we're doing is we have decided to modify our schedule in a way so that we don't have large influxes of patients in the office at any one given time. So there may be situations where you may receive a phone call asking for an appointment to be changed to a different time. And that's just to kind of control and minimize the impact in our space. That's the second thing we're doing. And the third thing we're doing is a question-based survey. When you come in, you will probably have someone ask you if you have a dry cough, if you're running a fever, or if you've been out of the country for the past 30 days. If any one of those questions are a yes, we're going to ask that you just reschedule for another time that's convenient for you after you've had some type of incubation. We know that this is an abundance of precaution that we're taking, but we want to make sure that everyone's health is secured, and this is the best way to do that. So what can you do for us? Well, you can do three things for us as well. You can make sure that if you're not feeling well, that you don't come in for your appointment. You just call us and just change it. We'll find a time that works well. We'd rather not have you here sick. That's number one. Number two, if you or any other family member have been out of the country for the past 30 days, we're just kindly asking that you don't come in for your appointment and that you just delay it to a different time. And the third thing is to make sure that you practice good hygiene. That means washing your hands with soap and warm water for at least 20 seconds as often as you can. If you feel the need to cough or sneeze, please do so in your sleeve or in your arm. And if we all do this, we will find that the virus transmission will be minimized and will not be much of a threat to all of us here in New Jersey and the rest of the United States. What we've noticed is that countries that have gotten out in front of this and have done a good job in limiting areas where groups of people are together have been able to manage it. And I'm quite confident that the steps that are being taken by the public health officials right now are going to go a long way towards succeeding towards the goal of reducing transmission. And within the next few months, I expect everything to be back to normal. So just to recap, we are open for business. We're seeing patients as usual. Here's to wishing you and your family good health and looking forward to seeing you next visit. Take care.